6, 5, 4, 3, 2, 1.
Hi, and welcome to this week's presentation of Hello Health. I'm your host today. I'm Alex Sampson from Health Benefits Associates, and today we have Dr. STEVEN Phillips here to talk about geriatric medicine, his role at Hometown Health, and his dual role that he's actually playing coming up here. Before I get into Dr. Phillips and talking a little bit to him about those kind of questions, I want to first of all introduce you to the program. This is a informational session that we're putting on, and we have other videos included in the Hello Health series that are designed to connect patients to doctors. And so our main goal here throughout everything we do, whether it's the health insurance plans that we offer, the in-person presentations that we have, or these one-on-one meetings with doctors, our goal is to connect Northern Nevadans with doctors. And so here, today, I'm going to be talking with Dr. Phillips. If you found that this video was helpful, we'd love for you to subscribe to our channel, and we can provide more informational videos for you. Another thing, the format of this video today. So we're hosting this on YouTube Live for a reason. We really would love for you to come participate in the discussion with us. And so we're going to actually be reading the comment section after Dr. Phillips speaks, and we're going to be going through some of the questions that are in there so that we can get your questions answered live. And so Dr. Phillips has worked in the field of primary care and long-term care medicine for frail and vulnerable elderly for the past 30 years as a clinician, researcher, and administrator. He remains involved at the local, state, and national level with an interest in enhancement of transitional care models, chronic care management, policy development, quality improvement, and population-based approaches. He has served on the National Committee for Quality Assurance Geriatric Measurement Advisory Panel since 2001. He's a founder and president of Geriatric Specialty Care of Nevada, and he'll talk a little bit about that today. GSC provides home-based primary care across Northern Nevada and will be entering the Las Vegas market in October of this year, 2021. Over the past 18 months, he has been serving in his dual role with Hometown Health and the Renown Medical Group, focusing on the development and implementation of a senior-friendly, comprehensive healthcare and primary care clinics. Working with medical and technological experts, he supports a more disciplined approach for participation in alternative payment models of care through the Healthcare Payment Learning and Action Network. He is also involved in the development of telehealth, telemedicine, and outreach to the underserved areas of rural and frontier Nevada. So without any more delay, let's get Dr. Phillips here. Thank you for coming on. Please grab a seat.
Thank you, Alex.
So I just want to briefly have a conversation with you. I talked to Dr. Phillips a little bit earlier, but really I was amazed about your role. Tell me a little bit more about that dual role that you're playing, and how do you see that kind of benefiting Northern Nevadans?
Right. Well, as you mentioned, I've been here since 1992, and I've been practicing geriatrics since '87 when I finished my fellowship. And it's always been my desire to be able to bridge between health coverage, so health plans, and the medical group. And it just so happened about 18 months ago, the opportunity presented for me to come back to the health plan. And what I mean by back is I founded Senior Care Plus in 1996 as the first medical director.
Wow.
And then things happened, and I went back to my practice.
Yeah. And so when you founded it, a while ago, and you've kind of seen Northern Nevada develop from, this what used to be a town as big as Fallon now. That might be actually overestimating it, into what it is today. So how has that role changed for a lot of doctors in your profession, and are you seeing, that technology being a huge advance, or what do you kind of see here?
Yeah, I've definitely seen good changes since 1992. I was recruited here by a company called Geriatric of America that ran senior clinics in 18 states.
Wow.
And Washoe Med, pre-Renown health system, contracted with Geriamed, and they needed a medical director, and that's how I came here.
Nice. Okay.
And at that time, the majority of care for seniors was often being done by their specialists, because there were even fewer primary care physicians or primary care physicians that had, if you will, interest in caring for an aging population.
Right. And so now you're working with kind of specialty clinics, so almost the exact opposite of just having your primary care kind of work on your senior population, and now into these clinics that are really focused on seniors. Right. And so tell me a little bit about those clinics, and I mean, how do they work?
And that's actually a return to the past for me, because that's what brought me here. Those clinics, the Geriamed clinics, really were exclusive, Medicare only.
Yeah.
And
right.
And
okay.
so now at the Del Monte Clinic for Renown Medical Group, it's a Senior Care Plus exclusive clinic. And so what it allows is more time for visits. Instead of 20, 30 minutes scheduled for a visit, it's up to 40 minutes. There's more attention to, you mentioned earlier, age-friendly approach. And what I mean by age-friendly approach, or colleagues of mine, are the 4 M's. And the 4 M's are what matters: mobility, medications, and mentation. And it's been shown that when you focus on those 4 M's in any population, but especially in 65 and above, then all of a sudden you're doing person-centered care. You find out what someone really wants. And if you don't know, you don't know. So yeah. There's a lot of screening that goes into the Del Monte Clinic. And then we also have a hybrid Senior Care Plus clinic, non-Senior Care Plus clinic at Los Altos in Sparks, with anticipation of future clinics opening more with that Senior Care Plus focus.
Good, okay. And then as far as those screenings, I mean, are you finding that doctors regularly catch things during these screenings? How important are they? Because I talk to my members about them. A lot of the time they think it's, just something superficial. They don't really see it from your perspective of how important it is, because maybe a lot of the members I talk to, they get the okay stamp at the screening or whatever it is, and they think, oh my gosh, that wasn't as useful as it is. Meanwhile, I do have people every now and then that they had something big that was caught, right. And they were lucky it was caught early by someone like you, and then they just absolutely think those screenings are essential. And so it's just such a difference. I mean, the screenings are important.
They're very important, and I think to differentiate, screenings from other screenings, if you will.
Yeah.
So,
please.
Doing, mammogram for breast cancer, we know that is worthwhile. I mean, it catches early disease, can therefore have earlier interventions. Colonoscopy for colon cancer, those kinds of screenings, I think we're all familiar with. But when I mention screenings from a geriatric condition standpoint, it's things that, such as vision loss. I mean, 45%
wow.
of individuals 75 and older have visual impairment.
Wow.
Auditory, so hearing, up to 40% over 65 have hearing loss.
Wow.
And hearing loss is now one of the top contenders or causes for dementia. Don't yet know the real causality of it, but so, and then other screening, functional screening. The World Health Organization about 25, 30 years ago published that the health of a society is inversely proportional to its functionality. And so, it's nothing to do with medicine.
Yeah.
But it's medical conditions that can cause functional impairment. And by functional impairment, I'm talking about things like dressing, eating, ambulating, toileting, bathing, hygiene, that we take for granted. But when one loses 2 of those you become dependent in two of those areas, may not be able to stay at home anymore.
Yeah. Okay.
So that's the kind of screening I'm talking about.
Got it.
And the final thing about screening is when I lecture to medical students and residents and around the country to other colleagues, never screen if, one, you don't believe in the screening tool you're using, and two, you better have resources available, because when you find something, you need to know what to do with it.
Yeah.
So.
And having a medical professional do that, I mean, sometimes these cognitive impairments, I mean, I've experienced it with my own family, just it happens so slowly, and next thing you know, oh, I didn't realize it was a big deal, and all of a sudden you're thinking, oh my gosh, no, this can't, I can't have somebody living like this where they can't perform these functions, or the hearing and the vision like you're talking about. Unless it happens right away, it's hard to notice.
It's exactly right. It's kind of like the frog in the boiling water. I mean
exactly.
And so with cognition, I mean, it's really now become recommendation for screening, because the earlier, or let me back up a little, less than 50% of individuals and caregivers have diagnosis of dementia, cognitive impairment, before it's already into late stages.
Wow. Okay.
So where we can intervene is by earlier identification, and because there are things we can do. And there's not a cure, though. Let's say I identify someone with early onset of impairment, cognitive impairment, and they have diabetes, and it's poorly controlled, and they have hypertension, high blood pressure that's not well controlled. By showing the presence of impaired cognition, all of a sudden that plan of care and ability to get better control of diabetes, blood sugar, better control of blood pressure, because those are the things that can slow progression.
Okay. Yeah.
So I can't overstate the importance of screening.
Okay. Good.
So.
And just a reminder for the audience, we are going to be answering the questions that you ask on YouTube Live. So please ask your questions on the side. I think a couple of them have come in so far, so we'll take a look at those in just a second here. But as far as the clinics go, now a lot of these clinics that are coming out are brand new. I mean, they aren't. Well, they're brand new in my mind. I've been here my whole life, but they are relatively new. And
Yes.
From what I understand, they're supporting our growing senior population. We have a lot of people coming in from California. Maybe they're retiring, maybe they're working, but a lot of the people that I see, at least, are in their, if not in their 50s, then in their 60s or later.
Right.
And they are coming in here definitely needing medical services. We talked a little bit about how they're used to that Kaiser model and that fully managed care model. They come in here and they see Hometown Health and Renown, and they are, ecstatic. Yeah. And so to be taken care of in that whole health sense, I mean, that's what these clinics and providers are designed to do.
Yes.
Okay.
And our goal, and so speaking as medical director for the health plan, is to become Kaiser-esque. And truly,
managed care.
And because I have 25-year experience with Kaiser. I've consulted with them for years in their frail population on chronic care management, care coordination, etc. And my mom's 94 and has Kaiser, and she still goes online to communicate with her her providers.
Yeah.
And so, yes, it's a real desire within the partnering of Senior Care Plus, Hometown Health, with the Renown Medical Group. That's why there's the Senior Care Plus Preferred Plan that requires that a member have a Renown Medical Group provider.
Right.
So yes, it's and the new clinic, Del Monte, I mean, if you haven't been there, it's worth visiting. I mean, they even have a fireplace in the waiting in the lobby.
Right.
I mean, it's not a waiting room; it's a lobby.
Yeah.
And it's again, it's age friendly, large hallways, large doorways. I mean, all the things, and large rooms, so that individuals that have a spouse attend with them, or daughter, son, the rooms are larger for that.
Yeah. But I mean, very much in my mind, separating yourself out from Kaiser, though, by still having that hometown feel.
Absolutely.
I mean, by still having people in town, by still having, doctors, providers that are here that are available. I mean, that ends up really, in my mind, separating you out from that model that a lot of people see in California. That some people they love it or they hate it.
Right.
And there are a lot of people I know with Hometown Health that did not, and with Senior Care Plus, that did not enjoy Kaiser, but they see that you have a whole lot of providers in Northern Nevada. They see that the hospital, the second hospital, that are absolutely amazing when they go in and have a loved one or have somebody they care about have the surgery there. I've had great feedback from those people about the level of care, and not just that, the technology that you've invested, or that Hometown Health, Senior Care Plus has invested in to make sure that everything is as state-of-the-art as it can be in Northern Nevada.
Yes, and I appreciate this, you making the distinction, not being exactly like Kaiser, but keeping that hometown. And that was always, for those who remember, back in 1995, it was not Hometown Health, it was called Hospital Health Plan, HHP. And it was a franchise out of Chicago, Hospital Health Plan. And when I was medical director, along with other folks, we made the conversion. We didn't want to get rid of HHP, right? But we didn't want to keep saying, who wants to go to have a health plan that's called the Hospital Health Plan? The last place you want to be is a hospital, right?
Yeah, right.
Unless you need to be. Yeah. And so yes, the hometown was a huge move in that direction.
Yeah, good. Well, I'm going to try to take some questions here from you guys, and if I could get those pointed out here. I have about the offices, new offices opening. We talked a little bit about this, but let's see. Is Renown opening new offices? So, sorry about that. Hold on just a minute here. And so, apart from the clinics, do you know if Renown is opening specialty offices? Have they always been? As far as I can see in Northern Nevada, Renown has been actively recruiting doctors since the beginning.
It's never ending.
It's never ending.
Both in specialty and have added about 35 plus, maybe I'm hitting 50 primary care.
Okay.
With more on the horizon.
Yeah.
Actively recruiting all the time. As far as specialists, areas that we're actively recruiting because the availability is not what we want it to be is, example, rheumatology.
Okay.
So that's one specialty that we're working actively on recruiting. Have been close a couple times, and then it hasn't happened. So and then another thing, when we think about just specialty, because geriatrics is a specialty in its own. So one thing we're offering through Senior Care Plus are these comprehensive health assessments, or CHAs. It's essentially an annual wellness visit, which allows all the screening that I mentioned and then some to be done. 70 minutes spent with a clinician, nurse, and a medical assistant. 70 minutes with no copay.
Wow.
And because it's under that annual wellness visit.
Yeah.
And it's being done by geriatric trained clinicians.
Nice. Yeah.
At both, or at three places: Del Monte, Los Altos, and Mill Street, 781 Mill Street.
Okay.
And our Senior Care Plus members are actively being recruited into that assessment. They don't lose their primary care provider, though. When it comes to comprehensive health assessment, it's often hard to do when you're dealing or addressing episodic issues, in the primary care setting.
Yeah, okay.
You're taking care of someone's blood sugar or their blood pressure or what have you. Whereas this is just carve out time. Everything is on the same, you mentioned integration. It all is in the Epic medical record system.
Okay.
So anything that happens during the comprehensive health assessment, all of the screening tools, conclusions, plan of care, is all available to the primary care provider.
Yeah. Oh, perfect. Yeah. I did get a question. I have health coverage with Prominence. Am I still eligible to go to Senior Care Plus clinic? I'll answer that a little bit. Prominence has their own dedicated clinics that they use, and then Senior Care Plus has the rest. And I would say between those two insurance companies, we're seeing that as far as in-town insurance companies with dedicated clinics, that seems to be the majority of the coverage. I can't say all, I will never say that, but it seems to be that those are the two big medical groups here in town. So most of my friends who are older are on prescriptions, but I'm not. Is this unusual? And so would you say that most seniors are on prescriptions, or how would you say?
Actually, it's 81%.
Oh, do you have the numbers?
No, I do. Well,
this
is what I do. 81% are on one or more medication.
Okay.
And it's also because 81% of folks over 65 have at least one chronic condition.
Oh, really? Okay.
And so that's where that number really kind of correlates. So is it unusual? Well, in my opinion, I'm 69. I never want to be on a routine medication. That's my goal in life. And so so far I'm not. So I think it's a nice group to be in. It's about 20% roughly of elder Medicare members are not on medication.
Yeah. Okay.
So it's a good sign.
That is a good sign. Yeah, and that's actually surprising to me. I mean, I talk to seniors every day, and it's not unusual in my mind for them to be taking just one minor medication, two minor medications a lot of the time.
5, 7. I mean,
well, I hate to say,
right?
I do have some people. Some people that are taking a lot, and usually they have some kind of condition that, a lot of this is not preventable.
Right.
And they but. That's a talk for another day.
And that's why of the 4 M's, medication is such a key thing. And it's also understanding your medications. And a real push now is what we refer to as de-prescribing. For too many years, it's easy to write this prescription and prescribe. It's more difficult to de-prescribe. The body changes as we age. A dose of even thyroid medication 10 years ago may not be the correct dose now, maybe too much because the body just can't clear it like it used to. Right. So yes, so that's another one of the M's that's so important. And medications also impact mobility, mentation.
Right. Okay.
Right.
Yeah.
So, and what matters? I mean, if I could go from 7 medications to 4, that's the quality of life.
Yeah. Absolutely. So tell me about your role with GSC. So that started. When?
Well, geriatric specialty care has been around really since 2001.
Okay.
Wow. And because in 2001, excuse me, or actually 2007, we closed down our clinic at the time, and excuse me, and sorry about that. Shut down the walk-in clinic and went exclusive home-based primary care. And so currently served from Gardnerville to Elko with 25 providers.
Wow.
Doing assisted living, group home, and private residence. And then during the pandemic, because many primary care offices shut down, we opened a clinic on Mill Street.
Right, okay.
That is doing extremely well. And so geriatric specialty care is primarily home-based, but does all of the comprehensive health assessments for Renown at those 3 sites that I mentioned. And also GSC is part of the Renown or Senior Care Plus Preferred Plan because of our partnership with the medical group and the health plan.
Oh, great. Okay, great. Let me grab another question off of here. Let's see. Older prescriptions. So how long, one of them, I think I can maybe address this, or maybe you can. How long does it usually take to get into the Senior Care Plus clinic? And so
they're accepting new patients right now.
Yeah.
I mean, they have capacity.
Yeah.
If you go on the Hometown Health site and look at available providers, it'll show you who's available. I mean, across the board, but Renown Medical Group specifically would be for the Del Monte Clinic and the Los Altos Clinic.
And again, from the feedback I've gotten from clients, they've gone right in, been able to receive care. Yeah. And I really only hear positive news once every blue moon. I only hear the clients usually only call their health insurance agent if I'm absolutely, can't get into a doctor.
Right.
So that's the only reason I get the call.
Right. No, and it's kind of like if the phone doesn't ring, you don't really know what's going on, right?
Exactly.
It's
kind of like the physicians don't get contacted unless you have a problem. If everything's going fine, nobody contacts you. But that's again the reason for the health screening.
Right.
Because everybody might think it's going fine.
Yep.
And then they don't realize that 80% of the hearing is gone.
Right, that's correct. And also with Senior Care Plus, as you know, Alex, they have their personal assistants, and so anyone who with the health plan has access to the engagement center, under Candace Dietrich, and they have their personal assistants. And so if you're looking for certain services, call.
Yeah, and that number right on the back of their card.
Yeah, right on the back of their card.
Call right in. It comes to the call center right here in town.
982 something.
Yeah. It's always there. It's always there. Let me grab another question. I won't keep you too much longer. I want to be really respectful of Dr. Phillips' time here, so I am going to ask a couple more, but I don't want to keep you too long. So thank you for your time. Good. We put the link to GSC on the website, so and we'll also include all of this information about Dr. Phillips in the link below. I think I'm going to probably wrap it up right now. We're looking pretty good. So again, if you have any questions about this, or if we didn't get to your answer, I really do apologize. We will get to go through the comments. I will go through the comments and make sure that all of your questions get answered. I can't thank you enough for participating. I just wanted to let you guys know that we do have our second series, Mastering Medicare, coming up on September 15th is our first presentation, and we can't wait to present those. Also, the next presentation will be coming up here. It will be this upcoming Wednesday, and I put the information on the screen here. You'll want to make sure not to miss it. So again, I'm Alex, and thank you so much for tuning into this week's Hello Health presentation.